Bismillahirrahmanirrahim. Slide is showing the picture of abdomen. On cutaneous examination, there is large erythematous annular plaque varying approximately 14 into 7 centimeter, located just right lateral to the umbilicus, involving the umbilicus tube, having targetide appearance. A central disky erythema surrounded by a central pellar zone and outer raised erythematous border, non-tender with no temperature gradient. In addition to this plaque, there are also multiple erythematous plaques and papules of variable sizes and shape with well-defined but irregular border with diffuse erythema, non-tender with no temperature gradient, located on the abdomen and right lateral, on the anterior and right lateral aspect of the abdomen extending to the groin. Surface is smooth, non-scaly, with little bit pudy orange appearance. They are blanchable on endoscopy. I will examine rest of the body. I will perform rest of the cutaneous examination to look for any other such type of lesion or any depressed atrophic plaque on the waistband area or bra area, and I will examine the hands and feet for shiny atrophic skin. I will examine the rest of the body, especially the ear lobes, for any nodular erythematous swelling. As my first differential is Erythema Chronicum migrans, indicating the Lyme disease, so I will examine all these type of lesion to check for the morphia, acrodermatitis chronica atrophicans, and lymphocytoma associated with Borrelia infection. Then I will examine the eye for any redness, watering, photophobia, and I will check the vision, and I will perform the direct light and consensual light reflex. Then I will perform the eye movements. Then I will check the facial nerve to ask the patient to frown, to close his eye against the resistance, to smile, to show his teeth. And then I will check the neck stiffness by lateral movement of the head and anti-reflection. Then I will check the sensation of the patient with the help of a toothpick to look for glove and stocking type of sensory loss. Then I will examine the tone and power of the muscles to look for any paraparesis and quadriparesis. Then I will perform all of the joint examinations, especially the knee joint, wrist and ankle joint, to look for swelling, redness, tenderness, and for the restriction of the movement. Then I will auscultate the chest for, I will auscultate the precordium to look for the pericardial rub, any conduction abnormality. Then I will also check the temperature of the patient, pulse and BP for any irregular rhythm and hypotension. On the basis of my cutaneous examination, my cutaneous and systemic examination, my first provisional diagnosis is Erythema Chronicum migrans, indicating the Lyme disease, generalized granuloma annulare, annular sarcoidosis, urticaria, insect bite reaction, contact dermatitis. Thanks.
Here this picture, my differentials are urticarial vasculitis, acute hemorrhagic edema of infancy, and Lyme's disease. For investigation, I would like to go for skin biopsy for histopathology and DIF. Then I would like to go for complete blood count with ESR, complement levels, autoimmune profile including ANA, ENA, hepatitis B and C serology, urine RE, complete biochemical profile, chest X-ray, Borrelia serology and PCR. For the treatment of acute hemorrhagic edema of infancy, I would like to treat the underlying infection and stop the causative drug. And other treatment options of urticarial vasculitis includes antihistamine, NSAIDs, hydroxychloroquine, Dapsone, colchicine, short trial of systemic corticosteroids, other immunosuppressants like azathioprine, methotrexate, mycophenolate, mofetil can be given. Other treatment options are plasmapheresis, IVIG, and biologics can also be given, including anakinra, tocilizumab, interleukin-6 inhibitors, and omalizumab. For treatment of Lyme's disease, options are amoxicillin, erythromycin, and doxycycline can also be given. Thank you.